And this video is skill 6.12, assisting with a urinal. Now for this video we're going to be assisting a male client with the use of a urinal. Yes, they make female urinals, but I don't know of any facility that is using them. So we just use a bedpan for a female. Okay, so this will be a male client that we are assisting with voiding. Okay, so we're going to gather our supplies and we're going to perform WIPSA. So what supplies do you need? Well, obviously you need a urinal. Okay, now you're going to be assisting with urine. You're going to be maybe having to put the penis inside of the urinal, so you want to make sure that you have gloves on. Okay, so you need gloves, you need a urinal. Okay, a chucks would be nice. Why a chucks? Again, like the bedpan, we can put it on the overbed table to keep our area clean, and when we're done, you know, when he's done voiding, we could take the urinal and we can put it inside of the chucks and cover it to keep it visually out of sight, as well as to keep the overbed table clean, while we're assisting to either clean the meatus, or having to maybe change the pad that's underneath of the patient if they got it wet. Okay, so we may need an absorbent pad to put it on the bed afterwards, right? So we always want to bring one with us. Always be prepared, right? We want to bring toilet tissue. Why toilet tissue? For voiding, right? Well, you may want to pick up those dribbles before they get all over the place. Okay, so we'll need toilet tissue. Okay. You may want perineal cleaner and a washcloth to clean. Now, if a man has been circumcised, the care is, you know, is a little less intense than an uncircumcised male. An uncircumcised male, they have not cut the foreskin off. So in order to be proper in cleaning the meatus, you want to make sure that you pull that foreskin back, and you want to wash the skin of the head of the penis and dry it, and then pull the foreskin back up over the head of the penis. For uncircumcised male, they should do that every time that they urinate, because you don't want germs to breed inside of that extra skin. So it is important to have some mechanism of washing. Okay. You can also bring towelettes that you could use to clean that area, or simply to wash the hands of the patient when they're done. Okay, so we've gathered our supplies and we have performed WIPSA. We're going to assist our client in the position of comfort for him in order for him to urinate. Now, this may simply be in the bed with his legs open a little so that the urinal can go in there. It could be sitting up in the bed, okay, or sitting with the legs dangling off of the side of the bed. Or it could be as simple as standing at the edge of the bed, leaning against the bed, and using the urinal. So whatever the position of comfort is for your client, you're going to put some gloves on. If your client is able to put the urinal in place by themselves, you could simply just hand them the urinal, and oh wow, that glove is gone. You could simply just hand them the urinal, and they could take it from there. If not, you would have to place it. So a urinal has a cap. Okay, see, cap, that you have to make sure comes off before you try to give it to the patient. So by off, I mean just uncap it. It still dangles. Okay, why do you want this on there? Because if you have to carry this from here to in the bathroom, you don't want it sloshing all over the place. Okay, So the cap is to keep the contents in there, okay? So you uncap it. You're going to, again, for purposes of this video, I have to take the covers down. You are not going to do that. You're going to try to keep them as covered as possible, okay? They may just flip them down because they don't care. That's all right, but you know, that's their prerogative. Okay, so you put the, expose the penis, okay? Can you see? I hope you can see. You're going to take the urinal, and the flat side is going to go down against the bed, okay? See the flat side? So that it can rest on the bed, okay? And what you're going to do is you're going to put it on the bed, and then you're going to pick up the penis, and you're going to put it into the opening. It's as simple as that. You're going to make sure that it stays in place. You can put the covers back over your patient at this point, okay? You can give them the call light. Make sure that they're comfortable. Make sure the side rail is up. Make sure they're not going to fall if they're laying in the bed, if they're sitting up in the bed, if they're sitting on the edge of the bed. If they're not stable, you may not want to leave them. You may want to stand right there with them. If they're standing at the edge of the bed, again, if they're not stable, you may not be able to leave, okay? If they're not able to hold the urinal in place, you may actually have to hold it in place and let them pee, okay? Yeah, I know. Not something that is on your list of priorities of things that you wanted to do in your adult life. But it's one of the things that we do as a nurse to help our clients live. Okay, so you may have to hold that urinal there. Just try to make it as uncomfortable as possible for yourself and that patient, okay? So if you're uncomfortable, just think about how they feel. So now they're all done voiding, okay? So if you've left the room, you would come in, perform hand hygiene, and put new gloves on. If not, you're standing here, you're ready, okay? You're going to remove the urinal, okay? Before you do that, you're going to get a piece of toilet tissue, okay? And while you're removing the urinal without splashing anything, you can grab the head of the penis and just kind of give it a good wipe to get any urine off of there. Now, careful, you don't want to be spilling the urine onto the bed. So you're going to be lifting up and out, put the cover on, okay, and putting this in the chucks on the overbed table, okay? At this point, you will do whatever it is that patient requires for cleaning, okay? You would clean the meatus, make sure that the bed is dry and not wet. If it's wet, you're going to roll them, get this pad changed underneath them, pull down their gown, put their sheets up, remove a glove, put the side rails down, or up, whatever, depending on your policy of your facility. Make sure that your patient has the the call light, excuse me, and make sure they're in the position of comfort and the bed is in low position. At this point, you're going to take the urinal to the bathroom. So here's the urinal, yes, okay. You can take it to the bathroom. You're going to note the consistency of it. Are there any flecks or blood or anything that you see in it? The color of it, the amount of it. This is all information that we need, okay? If it's odorous, fruity smelling, these are all important to know about urine. Urine will tell us a whole lot. You'll learn this in your nursing career here at Alfred State. So I'm not going to go into that, just you need to know that stuff, okay? So you're going to look at that. If you need a sample, you would have, procured it then, okay? If not, you're going to discard the urine in the toilet. Then you're going to wash the urinal. Do not just discard the urine in the toilet and put the urinal away, because one, it's just gross. That's just gross. Two, it breeds germs that way. And 3, oh, urine reeks, okay? After a while it dries and it's just smelly. And 4, it's just gross again. It's just gross. So wash it out. Many of you have seen those toilets at the hospital and you wonder, why does it have that sprayer connected to the toilet? Well, it's got the sprayer there for this purpose, so that you can, clean the urinals, you can clean the bedpans before putting them away. So you'd empty it out, you'd rinse it out, you'd clean it per your facility policy, and then you would store it wherever it's supposed to be stored, okay? You would throw out the chucks, you would go back to your patient's room, make sure that you wash the overbed table, take care of all of your supplies, make sure they're ready to go for the next time that the patient needed it, okay? You would remove gloves and perform hand hygiene, and then you would chart. What would you chart? The amount of urine if it was measured. And all assessment data, including whether it was cloudy, whether he had a reddened perineum, whether, just chart what you would need to know about the urine. And so that's for skill 6.12, assisting with a urinal.